I'm a cardiac nurse and I tend to work a lot with patients who have heart valve disease, and generally the older patients who are now having new minimally invasive heart valve replacements to treat their conditions. What we see with these older patients is, in terms of frailty and physical activity, it's quite reduced when they start to develop symptoms of shortness of breath and limitations in their physical activity. And post-procedure, when we replace the valve, we actually see them much more active and actually reaching new targets or new goals for themselves around physical activity. And I think one of the interesting things is, how do they work to personalize their own goals from baseline when they couldn't do too much to where they are now. So in my research, I'm undertaking a PhD, and we're looking at these patients and we're looking at traditional measures of physical activity to capture what we measure every day in practice: 6-minute walk test, gait speed, grip strength. But we're also looking at novel technology such as wearables to capture what people are doing in their real homes. So this is how it's becoming more interesting. A patient can improve after a heart valve replacement by 40 meters, but that's in a clinic, and that's in a hall in a clinic. It doesn't really tell the story of the 82-year-old who lives 2 hours away from the hospital, had to get one train and one bus and walk up 2 flights of stairs. That's the real physical activity change. So I think wearables offer that opportunity to capture what's actually going on in people's own environments. So I think because I'm working a lot with over 80-year-olds, many of them have not heard of what a wearable is before and are often perplexed when I bring the device along to them in clinic. So I introduce the device to them and we talk about how wearables are used, talk them through some training on how to place the wearables. We get them to keep them on for 4 days. In terms of monitoring the activity levels and that, where I'm actually doing a passive activity monitoring at the moment. So participants in the study don't actually see the number of steps they're doing or the amount or physical activity duration. So what they do after the 4 days is post it back to me, and then I download the data, analyze it. And then when the patient comes into clinic, we discuss what the results were. And so we do that at baseline and then at 1 month and 6 months afterwards. So at the moment, I'm using a Fitbit device. And so we're using the platform of the Fitbit to actually obtain the data or the data which has been processed, and capturing step counts and physical activity duration and intensity. So I think, there's a lot of guidelines out there in terms of physical activity. I guess that's the focus I look at in terms of, especially older people over 65. The UK has just released guidelines, physical activity guidelines that align with the World Health Organization about increasing physical activity in frail patients or patients who weren't so active, who have cardiovascular disease, and actually breaking up those prolonged periods of sedentary behavior. And I think if you think about a wearable, for example, you may have worn one and you get a small buzz on your wrist, which tells you how long you've been in a sedentary position, sitting down. Maybe you should get up and take a walk around the block or around your house. I think this offers an opportunity to measure something and make behavior changes that we didn't have before. So I'm hoping in terms of cardiac patients, we can factor this in a little more. So I think if you just take it back to the patients, what are we measuring? So again, we measure clinical things such as a 6-minute walk test to capture physical activity. But what does the patient want to know? What are the reported outcome measures that are going to change their behavior? If you knew you were doing 2,000 steps before you had a heart procedure, would you want to achieve 4,000 steps at 1 month afterwards? And so I think understanding how we can use wearables in this space and in clinical trials to implement and capture that real world data. Why should a patient need to, if that's a primary endpoint, a change in physical activity, why should a patient need to come back to clinic for me to do a 6-minute hall walk test when they could have a wearable and be in their own environment? So I think the design of clinical trials, potentially including wearables, offers this patient-reported outcomes in real-world settings.